Good morning, good morning, good morning. So this is just my typical routine in the mornings when I'm getting ready for work. This usually doesn't take me too long, and once I'm done with this, I am ready to go and get on the road. So let's see what we're doing today. Good morning. Welcome back to our channel. I am Anastasia. If you're new here, make sure you like, comment, and subscribe to our channel. So today is gonna be like a day in the life as LVN. I just thought that would be a good little video for those who are interested in what it is like to be LVN. There's not much content I think you can get, while at work because of HIPAA and stuff. But I'm just gonna try to get like as much as I can get without revealing any like information about the facility or the patients there. I am also a what they call registry LVN, so I pick up shifts as needed, like on my time when I want to work. And yeah, you just pick them up through the app. They show you the location. This one isn't too far from me. It is about 15 minutes, and we are on our way there. So yeah, let's have a good day. So I am here. I clocked in. This one is on the second floor. So yeah, clocked in on my phone, and I'm ready to go. We have already did reports. We counted the narcotics, and yeah, I'm waiting for them to reset my password because I haven't been here in a while, so I forgot. And I have 13 patients, so that's pretty easy. Like, I'm usually used to having at least like 25 and up, like 25, like 30, but 13 should be a breeze. I'm gonna do that, and then I think we have to do treatments here. I'm not sure, but we'll see. So this one is for a G tube. So we have a cup. I'm gonna put the medications in here, crush them, and then I mix it with a little applesauce to make sure everything is dissolved. Mix with water, and then we have a bolus feed, which is not a continuous G tube. Just means the patient gets a feeding every couple. This one's every. Alright, it is 9:20. I am done with my first med pass. I could have been done a little earlier, but I got stuck in a patient's room. Sometimes that happens. You'll get stuck. They like you are gonna run into some patients that like to talk. Yeah. So now I am just going to chart. The supervisor, he still didn't. I asked him to reset my password. He a little busy. He opened up his so that I could look at the meds, but I need mine so I can click the meds. So I'm gonna tidy up the card a little bit, discard these, and then I'll be back to do blood sugar checks blood sugars and insulins at like 11, lunch at 12, and then second med pass when I come back. Alright, y'all, it is 11:17. I have done all of my morning charting, I'm gonna get ready to go do the blood sugars and the insulins, and then I usually like to go to lunch around 12 because that makes my time go by faster. And I see that I have one TV test on here to do, so I'm gonna do that probably when I come back from lunch, and then look over the treatments. And yeah. Let me stop lying. I got stuff to do. I'm about to do blood sugars. I prepared my tray. I have the glucometer. I have some lancets. I always take extra. I only have 3 blood sugars to do, but I like to take extra. I have alcohol swabs, gloves right here, and usually I'll just walk this tray through the hall, but it's close to 12. I got delayed because patients asking for narcotics. A patient wanted their blood pressure checked. A patient is trying to get discharged randomly in the middle of the day without telling anybody. So it's a lot of running around. So I'm gonna take the cart with me, do the blood sugar checks, immediately give the insulin right after that because the lunch is out right now too. So yeah, and then it's my lunch. All right, y'all. It's lunchtime. We're going downstairs. I got my little drink, water. And I got leftovers for lunch. Last night we had smothered drumsticks, candy yams, and cabbage, so that's gonna be good. Okay, I am in my car. Usually on lunch, I like to watch me a little YouTube video, which I do have something pulled up, and I was just looking at it while I get everything out. But I do have my health assessment HESI exam coming up on Thursday. So I'm probably gonna watch 10 minutes of this video because you gotta give yourself something, right? I gotta have some type of fun. Anyway, so I'm gonna watch like 10 minutes of this video, and then I'm just gonna be doing practice questions for my HESI because baby, we gotta pass that test. Who failing that? I'm not failing that test. I gotta pass. Like, if you don't pass your HESIs, you don't pass your class. Mind you, I have an A in the class. I've been riding with an A all semester long. Okay. Imagine me not passing my class because I didn't pass a test. No. Anyway, so yeah. Watch 10 minutes of the video. Eat my lunch. Yeah. Then I'm going to do my practice questions. And then I go back up. I probably have a few meds because when I do blood sugars at 11:30, whatever time it is, I also I just came to lunch at 12, so I'd be like right at the borderline. So if there's some medicines due at 1, then I just go ahead and give them. So it'll probably be if I have any 2 p.m. medications due, and then finishing up charting. And yeah, it is 2:24, y'all. I have like 2 meds I just gave for the second med pass. So this patient was giving this guy is giving me a hard time. Mind you, like, he had medicine that was due early this morning, and I went to go. I think it was due at 9, and that was right on time. And I was like, oh yeah, I'm here to give you your medicine. He also has a GT, so I'm like, yeah, I'm here to do your bolus feed and your medication. And he's getting ready. So he's like, oh no, like I do that when I get back. I'm leaving. I have an appointment to go to. And I'm like, okay. But I asked again because he has a narcotic in there, and he had 2 of them. So I assume, like, when you register, you don't know the patients you don't know them that well, but just just using my knowledge, I assume that he may have like chronic pain. So I'm like, are you sure you don't want to take your medicine now before you go? Like, I could just give you the pain medicine because you might be in pain. He's like, no, like I'm going. I don't want the feeding. I don't want the medication. I'll have when I get back. Okay, that's around like 9, right? So I don't even know when he left. Actually, see did he see me? He's like, no, I didn't see him leave. Anyways, I go to lunch at 12, and I come back. He's at the front like, I need my medicine. No one came to give me my medicine, and I'm like, sir, I'm like, you told me that you wanted to go back. He's like, I've been back. Like, he's yelling. He's really upset. He's like, I've been back. I was like, oh, okay, I didn't know you were back. He's like, oh, that's BS. You didn't know I was back. Blah. Like, he's just going in. I mean, I'm just like, okay, like, I'm not arguing with no patient or person. Like, you just gotta have enough self-control, and you just gotta know that they're just, I'm like, okay, are you in pain? I'm like, I can get the medicine for you now. I can come bring it to your room now. He's like, okay. Well, I'm calling his medicine. I see he has a antibiotic due at this time. He doesn't have antibiotic out. So I go ask the DON, like, is this order over? Are you guys just out? She's like, oh, I don't know. We have to reach out to the doctor. She's like, we're just gonna continue it for another week or whatever. She's like, pull him the kit. So I have to go pull him the kit. Mind you, so he's back at the nursing station. Where is my medicine? I'm trying to explain to him. I'm trying to get your antibiotic. Like, he's just going off of me. Y'all, long story short, I end up calming him down, convincing him to go to the room. He is just nitpicking on everything I do. He's like, oh, you're going too fast. That hurt. I'm like, I'm sorry. It was kind of clogged. So sometimes when a GT is clogged a little bit, you gotta push it till I get to go through, or you're gonna send him out to the hospital. So I push a little bit so I can hurt. I'm like, oh, I'm sorry. Like, it was just a little clogged. He's like, yeah, I know. I'm connecting his feeding or whatever he has. I forgot what this is called. But it's like a feeding connected to the feeding, and then it's connected to the bag as well. I think it's called a kangaroo pouch. And in the bag you put water. So I open the package in front of him. I guess they don't open it in front of him. I open it in front of him, and I go fill it with water, and he's like, I'm not taking that. You just put that water in there. The water's supposed to come pre-filled in the bag. And I'm so lost because I've been over here for 3 years. I've never seen I've never seen a GT or kangaroo pouch come pre-filled. I'm like, no, sir. I'm like, this is how they do it. You probably just don't see them do it. They probably don't open it in front of you. They prepare it somewhere else in the community. He's like, no, I'm not having it. I'm like, okay. I'm like, I don't have to press run on the water right now. I can pour that out, and then like, no, ask the other nurses where they get your water from. He's like, no. Okay, this one. All right, sir. I'm gonna get another nurse to help you. Okay, I'll go get the other nurse. The other nurse like, yeah, he's mad at me too. He's like, I just poured it out, and I'm just getting some fresh water, and he's just gonna take it. He just tried to stress me out, but I'm not even mad. It's 2:30. It's almost 3. It's almost shift change. I'm gonna clean off the cart, prepare for the next nurse, do shift change report, finish a little charting, and I'm out of here. So this is the end of shift. I just clean the cart off, restock my water, the ice, and take out the trash. All right, that is it. This is the end of my shift. I clocked out. I finished all my charting. I gave report to the next nurse, cleaned the cart off, and you know, that's it. It's time to go home now. It was a pretty good shift, I'm not gonna lie. Like, it was pretty chill. I liked it. Yeah, so that's pretty much the gist of what I do in a day-to-day as an LVN. Of course, it does vary depending on what facility I go to. Like, sometimes we do the treatments. Today they had their treatment nurse here doing the treatments. And there can always be just a change in condition. So for the most part, that's it. If you like the video, make sure you like, comment, and subscribe. And yeah, thank you for watching.